I hope so. I truly hope so, and I believe so.
Yes, me too.
Change that mindset, right?
Me too, for sure.
Great. But what I love to do is for me and my audience to get to know you a little bit better. I would love to know a little bit more about you and your background and how you how you came to be what you are today.
Yeah, I've been in healthcare for the last 25 years. Super passionate about health, very passionate about longevity, actually. How can we help humans live a healthy, long life, right? Um, we keep spending more on healthcare. We keep investing more in discovering every year new technologies. Yet, I don't know if your audience know, but we lost last year zero point 0.5 years on our lifespan, or zero point 0.4 years. So we're living sicker, shorter. We need the opposite. We want to live longer and healthier. And that has always been my passion. And so I started my career in med school. I wanted to be a doctor, wanted to help patients, um, you know, get to a cure. And I faced kind of a little bit of two frustrations in practicing medicine. The first one, I felt that I was trained to prescribe a pill, or actually 4 or 5 pills for everyone coming to the clinic, right? I wanted to be a cardiologist, so you give a blood pressure pill and a cholesterol pill and a blood sugar pill, etc., etc. Everyone knows the story. And the problem is that these pills are not reversing the condition. So it's not like you take them for 3, 4 months and you're done. Patients just keep coming back, and first they have to renew their prescription every month, and then every year or two we just keep adding pills. So I felt like the chronic diseases that 90% of us are dying from today, we're presenting no true solutions for them. And the second frustration, I was meeting people after they're sick, so I was practicing sick care, not health care. I felt like, we wait for people to have a heart attack or have high blood pressure or have diabetes, and then we diagnose that. I was always comparing. I always wonder why we did better for our cars than our bodies, right? In our cars, we have a dashboard. We have first, you have insurance for everyone, right? You have to have an insurance for your car. And number two is you have a dashboard. You see the temperature, you see how much gas you have in the tank, you see what's happening, and then you can go to any mechanic and they can, put the car on the screening and tell you what's going on. When it comes to the most precious thing in life, which is our body and our health, we did not do that yet, and we build a system that makes more money and operates when we are sick, unfortunately. So that became a frustration. I decided then to go in health policy and public health, thinking, hey, how can I change the healthcare system? How can I advocate for prevention? How can I advocate for true cures? And I had two hurdles there. So I did my studies at Harvard and Hopkins, had a great career, did a lot of consulting with multiple governments around the world. Um, but then I hit kind of a wall whereby prevention, there was no product that people like to consume, right? And there's no product that people can consume to stay healthier longer. We had sets of educational and recommendations: exercise, eat healthy, sleep well, stress less. But practically, like, it's not easy, right? I mean, some people, everyone knows, basically the frustration is everyone knows that we should do those, but practically you're tempted every day with competing products. So if there's a burger on the table and you're hungry, most people are leaning toward that burger. If you want to watch a movie on Netflix at night versus going to the gym, you're gonna watch that movie. So we got to compete with those with a healthy product, and that became my passion. So I joined the biotech industry to learn how to discover and launch healthcare technologies, and I was on the look for what could be an intervention that can keep people healthy and potentially help with disease remission. And I was lucky enough to meet the founder of the company that I'm a CEO of today. His name is Walter Longo. Um, Probably a lot of people listening to us today would know that name. He's the head of the Longevity Institute at USC. He is probably the global leader in longevity and nutrition. And, and he kind of changed my life in a sense that there is a product we consume every day of our life, that's food. We consume it 3 to 5 days every day of our life. And his theory, if I can tailor nutrition to be an asset for longevity. We can keep people healthy long. And if people have a disease, today we live 10, 20 years with the chronic diseases. So we still eat though. And if we can tailor nutrition as part of the therapy, this is food is medicine, and then we can help probably patient reach remission faster. And that was his mission in life. He spent a good over 2 decades researching food for longevity. Today, that's the consumer part of our company. We have a pipeline of nutrition that we're positioning to help people, increase their chances at a, healthy, better life. And then I always say my goal is to live the best 10 last years of my life. This is where a lot of people, they don't want to live longer, but they just don't want to be sick and suffer the last few years of their life. And then the medical side of our company is we develop nutrition that we tailor for patients with diabetes, patients with Alzheimer's, cancer, and cardiovascular disease, the four big killers. So I left everything and I joined him, and I became CEO and chairman of the board. Our company is called L-Nutrra. L is for longevity through nutrition. So L-Nutrra, and we've been working together for close to a decade now on how can we bring food as medicine and food for longevity.
Beautiful. I mean, everything that you talked about is everything that I live by, and what I also say to my clients, to just people in general. First off, food is medicine. I don't know, I don't think I mentioned this, but I am certified health coach in functional medicine. So that is the actual quote.
Yeah.
The what we believe in is food is medicine. And the fact that now more people are realizing this, but it is still an uphill battle. I'm sure you're aware of this, because of healthcare or sick care, exactly how we say it as well, is prevalent. That's the number one that's coming to every single person nowadays.
Yeah.
And it's something that I think we all just need to, just keep going, keep speaking our truth, and help others. And, L-Nutrra being the one, probably, I haven't tried it per se, but I know that, some people that I know some people who have tried it and they did like it. And so I know it's out there and I know it's have results, but what I want to know is, how does someone start the program? So you talked a little bit about L-Nutrra. I don't know if you want to go into a little bit more detail of what it is. And then maybe in that detail, just kind of walk us through how people started, or the journey through the program.
So the biggest discovery in our nutritional research was a product that we called Prolon, or a full consumer business unit. Prolon is Prolon, and it's for promoting health and longevity. And basically, we started to studying fasting, the impact of fasting on the body. And a lot of people now know about fasting and the positive impact. But intermittent fasting, skipping breakfast or doing a short-term fast, is great for weight balance, metabolic reset. What we have studied is what we call prolonged fasting. Is if you go beyond 16 hours, if you go 1 day, 2 days, 3 days, 4 days, 5 days, we spent 2 decades. We have 18 universities now, Stanford, USC, UCLA, big research centers across the globe. They're doing research with us on what happens within the body if we fast for a longer period. And why we're excited about a little bit longer, because when you fast for a little bit of period, you have enough fat in the body, you break fat, you break the reserves, and then you nourish the body. So that's great for weight management. And if you do that, there's a lot of positive benefits on inflammation, on blood pressure, on blood cholesterol, etc. When you go a little bit longer, the body goes into a little bit a deeper crisis. And because the body's telling the cells, well, I cannot nourish you any longer. I'm burning my reserves, my fat. You got to go inside of your cells, and you got to find debris and organelles to consume. You got to rejuvenate, you got to fix. We got to be at our best to survive together. So every cell in the body, when you fast, every cell in the body goes through that stress, because every cell requires calorie to survive. So literally from your top of the head to the toes, the cells are saying, okay, we gotta try to be at our best to survive. This is a rejuvenative process. This is for the first time we are impacting cells to rejuvenate. And this is why fasting now is correlated with longevity and living healthy long, because you're putting the cells in check. It's like if you're doing a car race, you see the car sometimes taking a pit stop, the mechanics come in, they screen what's going wrong and they try to fix it. And the body to survive a longer fast does the same thing. So the golden day is day 2 and day 3. Once you cross those, most people get into that crisis and they start fixing the cells. So nobody wants to fast 3, 4, 5 days. And when we presented the amazing outcome in mice, because this is how we started fasting mice, and then went to the National Institute of Health. We said, hey, how in humans is going to be difficult. And they actually gave us millions of dollars to develop what we call the fasting mimicking diet or the fasting mimicking nutrition. Can we nourish the body for 5 days, but give the signal of fasting to the cells? And this is what Prolon is. Prolon is a 5-day nutritional program, very easy. You get a box at your home, you order it, you get a box at your home. You don't need to eat or drink anything else except just water. It has your supplements, it has your food, and it has your drinks. And you consume it over 5 days, and your body thinks that you're not eating. And everyone asks the question, how come you're eating and the body thinks you're not eating? Well, we studied how the body recognizes food. What are the hormones that when you eat, they increase, and they send like insulin and insulin-like growth factor. They tell the body there's food. So we designed the food to not spike these food recognition hormones. And at the cellular level, we spend, decades looking at how a cell thinks there's food and is satisfied, or is not satisfied and is still fasting. So we start looking how much each receptor you could nourish, so that the cell says, well, I'm getting nutrients, but I'm not satisfied. And we designed the diet to go around the receptors of the cell, or to go through the receptors, but not at the level that triggers the recognition of these receptors. We call them the nutrient sensing pathways. They sense food. So the fasting mimicking diet, or Prolon, is a 5-day nutrition that nourishes the body but does not take the cell off fasting mode, and therefore helps you rejuvenate and lose the weight at the same time. So it's a bridge between a short-term metabolic reset. A lot of people love it because they lose a lot of fat, they improve their metabolism, etc. And by the way, it protects muscle. That's a big thing. Fasting works as a stress, so the muscle rejuvenates. And a lot of people are today on Ozempic, they're on weight loss diets, and they're losing, I think, close to 30+%, 20 to 30% lean body mass on Ozempic and others. Whereas with Prolon, we have a patent and 2 clinical trials that you don't lose lean body mass. That's very important, because when you go off the plan, whether it's an Ozempic or a Prolon or any other diet, you don't want to be like, I just cut my muscle and now I'm going to have a low metabolic rate, and then I'm going to pick up back fat as soon as I eat. That's critical. So with Prolon, you don't lose this lean body mass. You are losing a lot of fat. At the same time, you're pushing your cells to rejuvenate, and it bridges the short-term metabolic reset with cellular rejuvenation. And this is why it was awarded, it's the only product in nutrition to be awarded a patent for promoting rejuvenation and longevity.
Nice. I mean, don't we want to live forever, healthy?
Well, yeah, some people want, some people do not want. But I remember I was a professor at the Buck Institute for Research on Aging, and we were rebranding the website and the positioning of, how can you tell people how you can position an institution for aging or longevity? And we were doing, questionnaires, and we asked people, do you want to live long? 60% said no. And it was a shocker. So we went back and we asked, and they said, well, I don't want to be like my grandma, she's suffering, or my mother, she's suffering at the end of it. So everyone goes back to it's not that they don't want to live longer, is they just don't want to be sick for a long time. So when we went back and we asked about health span, this is the right word, the word health span, how long do you want to be healthy? And then they want to be healthy, as you said, as long as possible.
Exactly.
And so healthy longevity or health span is the key word that most people want to reach.
You bring up a couple of things. Well, actually, there's 2 things I want to touch on regarding the health span. it's interesting because technology now is wanting for us to live longer. And I think I put a post out some time ago saying we're not living longer, we're dying longer, right? So I know that you touched on, it's a short health span, because if we are at age 60, say 50, 60, we're then that's when, everything is quote unquote going downhill.
Yeah.
But what technology and what healthcare or sick care is doing is they're trying to extend that sick care, or that span. Yeah. And so who wants to live that long? But if we're doing regenerative therapies, if we're doing, this fasting mimicking diet, if we're doing things that prolong our aging, why not live until 120, but then feel like you're at that point, I don't know, 80 or 70. So it's definitely something that's out there, and it's something, again, it's an uphill battle, meaning that people have choices. Do you want to go to one part, choose one thing and keep taking that drug, keep taking, the Ozempic, and think that you're doing well, but then you're getting sicker and sicker? Or do you want to say, okay, well, I'm going to spend a little bit more or do a little bit more for myself, and then in the end, you're actually going to be winning on that side? So we all have a choice. It's just a matter of choosing.
Yeah.
Yeah.
What you're saying is critical, and a lot of people, like, and subconsciously they know that, right? And there's 5 pillars to live healthier longer. Everyone asks me, like, or many people ask me, what are the 5 pillars of longevity, right? What can I do to live healthier longer? And the study shows that, again, nutrition is so key because it's the only product we consume every day of our life, 3 to 5 times per day, right? Some people once or twice, but most Americans consume 3 to 4 meals a day. I mean, that's the only product that we put in our body. So it has the biggest signal to our microbiome, to our epigenetics, to our metabolic, well-being, to our cellular aging. It's just so impactful. So, and this is where we specialize. And we lead in longevity in 2 ways. We talked about Prolon and the fasting mimicking diet. We're hoping that we're getting you backwards when you fix the cells, right? So we're hoping that at least, and that's a hope, temporarily, we're a little bit, you use the word rejuvenation, or going a little bit backward. And the rest of the pipeline that we focus on is how can I decelerate your rate of aging, right? I like to compare our life into like a car race. If you're in a car race, that's the race you want to come last, right? You want to stay longer and you want to come last. So what can you do to come last? You can slow down, right? Slow down, intermittent fasting, weight loss, eating healthy, eating less, calorie restriction. You can, but what people don't know is every time we eat carbs and proteins, they're essential for life, but they push 2 aging hormones, insulin and insulin-like growth factor, IGF. So every time, this is why calorie restriction is probably one of the most proven longevity measure. So, but every time we overeat carbs and protein, we're pushing our body to age. And people think it's only carb is bad. Protein is equally a push for growth, right? I mean, you eat high protein, you grow muscle, but guess what? Everything is getting the push to grow. We don't grow anywhere. We grow towards our end. Our body ages in one direction. And so every time we eat carbs and protein, we're a little bit pushing the aging of our body. This is why fasting is a big anti-aging intervention. So how can you decelerate every day through food? We actually have a pipeline of nutrition, the fast bar, the fast shake, the L drink, etc., which nourishes your body, but they don't spike high IGF, they don't spike high insulin, so that every time you're eating, you're not paying the price of acceleration of aging. And these are the 2 big, if you want, endeavors we have in nutrition is can I push you a little bit backward with the fasting, with the 5-day fasting nutrition or the Prolon 5 days, and can I decelerate your age every time you're consuming food with us versus your typical food that you eat every day, which will spike insulin with carbs, which will spike IGF with the proteins.
Got
So
it.
that's pillar number one for longevity. Pillar number two is exercise, right? Exercise is a little bit like fasting, right? We say exercise 3 to 5 times per week, and then we say do stress exercise, right? The
Mhm.
intensive. It's a little bit like the fasting, where when you shock your body has to adjust to it, so opens new channels of saving and protection,
Right.
and that's exercise. And then sleep is number three, and then definitely stress is number four. Number five, which competes actually out of its impact with nutrition, is social capital, happiness, that sense of purposefulness, being serene, being happy, being well in your nest is very important. Our founder studies centenarians, people living 100 and beyond, right? Because this is how you want to learn. You want to learn their food, you want to learn their lifestyle, and probably the top common component is that they're happy, they're serene, they live with their family, they stayed in their village. There's just that everyday happiness, which probably is the mother of all positive behavior. When you're happy, you're active, so you exercise, then you sleep better, then you stress less, then you eat healthy. So nutrition and that everyday's happiness, they compete for which one is probably the bigger pillar for longevity.
Of course. And yeah, the cognitive space is, and that's exactly what I believe, is that once you get your cognitive space, meaning you're in that, in the terms happy mood, or you're feeling good, and you're not chronically stressed. Stress, obviously, we're talking about stress of the exercise, stress of um, the fasting, but that's a good stress. Then you're talking about chronic stress, which is pretty much 9 times out of 10 people nowadays are chronically stressed. But once you get your mind into that happiness state, that state of where clarity, you are able to make those choices. You are able to make those
Yes.
nutritious choices. You are able to make I want to go for a walk. I want to go for a run. I want to, it's not always easy. Every day is not going to be the same day. But that's what we aim for in terms of our intentions of why we're getting up every day, is because first the cognitive, and then everything follows after that.
Yes.
Yeah. I want to kind of go into regenerative agriculture, and or sustainable farming, as you have it on the website. It is such a hot topic now.
Yes.
My last interview, I even talked about it in terms of reducing the carbon emissions in the environment. So my question to you is, do you see this as a paradigm shift, or do we have a long time to go? Like, are we close to getting to where we need to be, or is this still a long way out?
We ourselves have started a project that we call Nutrition for Longevity, and it has a farm and it has kitchen and it's regenerative farming and it's a pure, clean, and we love, nutritionforlongevity.com if you want to go and check it out, and you can buy food every day from there. It's actually Medicare and Medicaid just approved us to be food as medicine. They gave us a code for reimbursement,
Good.
and now 62 health insurances signed Nutrition for Longevity to reimburse our food as medicine, no deductible, no copay, for patients with diabetes or hypertension or cancer or other disease. So we're proud to announce today that we have part of our nutrition is now reimbursed as medicine officially by the U.S. government and many insurances. To answer your question, the problem, in my opinion, being now in the field for quite enough, or long enough, the problem doesn't always lie within the medical system or the policy. A lot of it lies also in the nutrition company themselves, because they want to go shortcuts, right?
Mm-hmm.
Oh, you should go vegan, therefore try my ice cream, it's vegan, and that ice cream has 600 bad stuff into it, right? You want to go vegan, I'll sell you a vegan meat, and it has colorant in it, by the way, which we don't declare, right? You want to go vegan? I'll give you a vegan protein, and I have so many bad things into it that are under 2% each, so that I don't have to declare in the label, but it'll help me make it taste good. So a lot of the nutrition companies, to cut costs and be profitable, because they're for profit as well, they're actually are not creating that credible, ethical, evidence-based alternative to the current system. And doctors and dietitians are just lost in between, right? I mean,
Yeah.
doctors want to do the best for their patients. The health system wants to do the best for the patients. But you look, the FDA does a great job regulating pharma and biotech. When it comes to food, everyone tries to have their own cutting corners and cheating around and trying to. I mean, now most of the vegan food is actually becoming even unhealthy, like with all the additives, all the loaded carbs and the loaded fat to make it taste good. And so I think the work has to start by regulating more the nutrition industry, by pushing more the industry to do clinical trials like drugs. We have done 32 clinical trials, 18 of which are completed and published, and the others are coming. I mean, you're a professional health coach and integrative, functional doctor. If I ask you today, name 4 articles of any nutrition company that show exactly what they do, you say, well, I don't know. I think they're good because they're gluten free and they have
Yeah.
low carb. And so the problem is when business comes into nutrition, nutrition is essential to life. We should not allow business to play with our life. And this is where I think our company is way beyond or separated from others. Our founder, Professor Walter Longo, has set a completely different book of ethics in how we do our business. And just for everyone to know, he actually donates all his shares in the company to the Create Cures Foundation. So he's making nothing back out of it. And this is how we were able to separate the business ethics from the true technology and true development of the nutrition. And that has been behind our success. You try Prolon, it's gonna work. And when we say it has 1, 2, 3, 4, 5, it does have 1, 2, 3, 4, 5. We don't cut corners. We don't compromise on things. We suffer actually a lot because there's so many shortcuts we can take to drop cost, to make more profits, etc., that we don't take. But to go back, that has been the biggest issue. I agree with you for pollution reasons, for sustainability reasons, even for what I just mentioned before, not spiking IGF with meat consumption because that's an aging factor, and not over spiking insulin. Being the longevity studies, they actually don't show that vegans live the longest. They show that pescatarian slash flexitarian live the longest. And why? Because life, we always recommend like one diet. One diet does not fit all. And everybody is different, but also ages and needs are different, right? If you're between age 40 and 60, this is when diabetes starts, this is when cancer starts. You want to be as close to vegan as possible so that you don't push the aging hormones and the disease acceleration hormones. If you're 85 or 80 or 75, muscle is an organ of longevity at that age. It's so important. And therefore, you want to actually have some meat then. You want to be more, at least pescatarian to get a little bit more of the fish, source of protein, but maybe sometimes also meat throughout. If you're between age 0 and 20, you have to grow physically, etc. Probably being vegan there is not going to save you longevity. You
Right.
got to have some meat. So we believe maybe meat front end of life, then a little bit less as you get close to that pre-disease setting, then back into flexitarian. So in my personal prescription, I would go flexitarian from 0 to 20. I go a little bit more pescatarian slash vegan, close to that 40 to 60, and back to flexitarian after that.
Yeah.
But again, each person is different, and you got to tailor nutrition to people. We're very different in our microbiome and our epigenetic and how we absorb things. You give an ice cream to a person, it spikes carbs. You give it to another person, it doesn't do that. But we don't want to generalize, but that's the highlight of what we believe is correlated with longevity.
Yeah. And I agree with that. It's just amazing how many people, and I'll say it, I did it before. I was always a, paleo for life, or keto for life, or I even did a carnivore for a hot second. That wasn't good. And so everybody has their thing, but it, as you said, it shouldn't be for life, and it's not for everybody. So number one, it shouldn't be pushed on anybody. We got to figure out what, based on doctors, and also how we feel after we eat certain things, and how we how our bodies react to a certain like meat or even some vegan food. And even if it's the whole food vegan food, sometimes reacts to certain people as well. Or as you said, our chemistry is not the same. I'm currently doing like the flexitarian pescatarian. I'm kind of like,
this is what I am as well. Yeah.
And I don't have a lot of red meat. If I do, it's grass fed or pasture raised or bison, or something that's not factory farmed. But I do have vegan dishes. I am also teaching, kind of letting people know that you could have vegan dishes and not be a vegan. You know what I'm saying? So yeah, bringing in all sorts of different types of foods depending on where you're at in your life is definitely key. So I'm glad that you touched on that. Do you have any case studies? Do you have any testimonial case studies that you can share with us?
Well, we have full clinical trials. We have a lot of, I think we're touching on 1.1 million consumption of our products. So we have a lot of testimonials. We have a lot of case studies. I, as a MD, PhD, I have 2 doctors, 2 masters. We are big believers in randomized clinical trials, and that's the ethics we bring to nutrition. I can mention a lot of case studies, but I don't want to claim based on, but I want to summarize that when you do fasting and the fasting mimicking diet, there's a lot of transformational things that happen to the body. All what I wish today is for people to potentially, if they're eligible to do Prolon, to try it, whether it's the 5-day fast. We have a 1-day fasting nutrition. We have for intermittent fasting, the fast bar or the fast ring. And again, as I mentioned, we're launching soon the longevity or the L drink, which has 24 grams of protein and other products to decelerate the rate of aging. Have a lot of, but as a CEO of a company with products, if I mention testimonials or claims, that will be looked at different. But you can read a lot of that on our websites and see the results. Yeah.
Awesome. Thank you. Yeah, that's another question, is where can we find it? So I'll definitely link up everything in the show notes. There was something that just came to mind and it just left. But in terms of the fasting and the Prolon, and when should people do this? Is this like an anytime thing? Is this kind of like a detox? Like they should. So when should people do this?
So most people do Prolon, the 5-day fasting mimicking diet. They do it 2 or 3 times a year. So you will rarely hear a CEO telling you, you don't have to do my product every day or so give me out of 365 days of a year, just give us 15 days. That's it. So do Prolon, anytime you want for 5 days, wait 4 months, do another Prolon, wait 4 months, do another Prolon. Some people do them in a row, and meaning once a month. It's never like back to back. It's just one Prolon month 1, one Prolon month 2, one Prolon month 3. We have tested that a lot in our clinical trials, and it showed major benefits. So basically what we tell people, do it 3 times. If you're healthy, you just want to do it for metabolic reset and cellular rejuvenation for the healthy aging that we talked about. You just need to do it 3 times per year. Some people, they carry a little bit overweight. They want to accelerate that, fat cut. Because you would lose 5 to 8 pounds per cycle per just 5 days. Fasting cuts fat very, very fast. Some people do 4 times or 5 times or 6 times per year because they have metabolic reasons or other reasons they want to benefit a little bit more. Most people can do Prolon. It's a plant-based natural, no chemicals, no artificials. So it's a very healthy ingredient-wise diet. But not everyone should do it. If you're pregnant or lactating, you don't want to fast at that time. If you're, end of life and you have multiple healthcare conditions, you should talk to your doctor and not jump to it. And you have any allergies to the ingredients, you should not be doing it.
Perfect. Thank you.
Yeah. And
Awesome.
if you want to read more, you can go to prolonfast.com or prolonfmd.com for fasting mimicking diet, and you read information about the products there. If you want to know more about the mission of our company and who we are, and read more about our science, about us, our philosophy, our mission approach, go to L-Nutrra.com. L is for longevity, -Nutra, Nutra.com.
Perfect. And like I said, I'll link everything in the show notes. It has a click. That's all they need to do. It's easy. But thank you. Is there anything that I haven't asked that you would like to touch on or talk about?
I think just my wish for everyone is to be happy every day. We talked about that. I think life is not worth all the problems that it artificially poses on us, right? Yeah. Every one of us, whether you're poor, rich, healthy, unhealthy, mom, dad, son, daughter, everyone has a lot of things to do every day, and a lot of pressure, and a lot of self-inflicted wounds or other inflicted wounds. I think you just need to look at life in a much more positive, purposeful way, so that happiness and positiveness keeps you healthy, keeps you fighting. You eat healthy, you sleep better, you stress less, and then you can deal better with your issues, and lead a healthy long life. That's my biggest recommendation for longevity. A lot of people ask me, what is your top recommendation for nutrition?
Yeah.
I think if you ask me what is the biggest game changer, probably, I mean, I'm a big fasting mimicking diet, obviously a Prolon fan, but I think dinner is the biggest changer in our health span. If you eat dinner late and you snack late, you're spiking the fat storage at night, and you're spiking growth hormones. So you're aging and you're storing fat, which is the worst two things you can do to life. And I think that has been the biggest negative lifestyle change that we acquired lately, right? With this, we order Uber Eats late, we have popcorn, we have Netflix, we have Facebook, we flip on our phone TikTok every night, and then we add another snack. So if you want to eat a little bit earlier and do not eat for 2 or 3 hours before you sleep, that's probably one of the biggest transformation, because we preach people every day about diets and eat healthy. It's difficult. It's difficult to change if there's one thing you want to do that. It will unlock a lot of changes in your life.
Awesome. Yeah. Obviously as a health coach, it's all about behavior change. So what's the smallest step that you can take today? And that's beautiful. That's exactly what I think that small step to the next step is to just eat a little bit earlier. Yeah. Exactly. 2 to 3 hours before sleep. So thank you so much, Dr. Joseph. It was such a pleasure to have you here. You enriched us with all your knowledge, but L-Nutrra, Prolon, everything else. I loved this conversation. It's just, I can eat, sleep, whatever, all of this, and appreciate your time being here. So thank you
very much.
Yeah.
I appreciate you very much. And again, hopefully we changed somebody's life. I'm pretty sure we did today.
I'm pretty sure we did. Well, thanks again, Dr. Joseph. Yeah, you too. And everybody else, have a good one. Bye-bye.